All right, so today we're diving into a really critical issue, one that honestly affects all of us, the state of public healthcare. The source material we're looking at lays out a pretty stark picture of a system in crisis and a public that's starting to demand some real accountability. So let's break it all down.
So let's just start with this quote because, wow, it really cuts right to the heart of the whole thing. The source says that official claims about improving healthcare are a cruel joke for citizens who face the reality of decaying public health institutions. I mean, that one phrase, it just says everything about the huge disconnect we're going to be talking about.
So, where does this all start? Well, it starts with a system that seems to be falling apart at the seams. We're going to dig into this massive gap between what's being promised and the tough reality that people are actually living with day in and day out.
And this is where you can really see that conflict in black and white. On one hand, you've got the official story, right? Hospitals are places of healing, of care, and improvement. But then, you look at what citizens are actually experiencing, and it's a totally different story. One of crumbling buildings, not enough doctors, and even a lack of basic medicines.
And look, we've got to be really clear here. This isn't just some abstract policy issue. This hits people where they are most vulnerable. The source material really drives home the point that, for so many people, this decay means a desperate, daily struggle just to get the most basic medical attention.
You know, a system like this doesn't just decay on its own. It makes you ask a really tough but necessary question. What's driving this? And that brings us to our next section, where we're going to follow the very serious allegations of corruption that the source material points to. Right. So it's one thing to see the symptoms, the broken down equipment, the empty pharmacy shelves. But what's the actual disease here? The source material really pushes us to look deeper, to find the alleged root cause behind this whole systemic failure.
And here it is. This is the explosive accusation laid out in the material, and it's coming directly from political opponents. They claim the government is, and I'm quoting here, systematically destroying the health sector through corrupt practices. Now, it is absolutely vital to note who is making this claim, political opponents, so we can understand the full political context. Okay, corrupt practices. That's a huge accusation. But what does it actually mean on the ground? Well, the source breaks it down into three key areas. First, procurement. So think about how everything from bandages to MRI machines gets bought. Second, appointments. Who's getting put in charge of these critical health institutions? And third, fund management, which is just a straightforward way of asking, where is the money really going?
So you've got these really serious allegations floating around. But how do you even begin to check if they're true? The source suggests you don't need a team of accountants to start. You just need to look at the reality on the ground. Because at the end of the day, that is the ultimate measure of any government's real priorities. And this table just lays it all out, side by side. On the left, you've got the official lines. We're improving healthcare. We're increasing funding. But then on the right, you see the reports from the ground, and it's a completely different world. Equipment that doesn't work, staff that doesn't show up, and a severe shortage of essential medicines. The gap between what's said and what's done is just massive.
And this, right here, this really gets to the core of the whole argument. You can put out press releases all day, you can make all the speeches you want, but the true measure of your commitment isn't in your words. It's in the condition of your local hospital. That's the real report card.
Okay, so it's a pretty bleak picture. But, and this is a big but, it's not a hopeless one. The source material doesn't just point out the problem. It actually offers a potential solution. So let's get to the part that's all about empowerment, the path for citizens to demand real accountability.
The source lays out this really powerful three-step toolkit for citizen action. Step 1, organize social audits. That means communities getting together to investigate and actually grade their own local hospitals. Step 2, use the Right to Information Act, a law designed to give people access to government records, to demand total transparency. And Step 3, use all that info to build a public campaign that just can't be ignored, one that pushes for a truly independent inquiry. Let's just dig into that second step for a minute, because this is where the rubber really meets the road. Using the Right to Information Act isn't about asking vague questions. It's about demanding hard data. Things like, show us the fund allocation records. How much was spent on maintenance? Let's see the details on equipment purchases. Give us the data on the medicine supply chain. This is all about replacing suspicion with facts. And that, right there, is a total game changer for accountability.
And all of this brings us here, to this one last fundamental question that's bigger than just healthcare. When the institutions that are supposed to serve us start to fail, does that power and maybe even the responsibility shift back to the people? It's a pretty provocative thought, and maybe a necessary one for all of us to consider. Something to think about.